Well, with concerns the coronavirus could soon spread to countries with weaker health systems, how should governments respond? Well, I spoke to Sian Griffiths, the emeritus professor at the Chinese University of Hong Kong, who co-chaired the SARS inquiry for the Hong Kong government in 2003. I began by asking her to explain what the WHO's declaration of a global health emergency means in practical terms.
The reason they've declared it a global health emergency is so that it can be recognised that the disease has spread to so many countries that even lower middle income countries need to take precautions against it, and they may well need help in strengthening their health systems to prevent the spread within those countries. So that's what it really means. It means very little in countries such as the UK, where the response has already been stepped up.
But does it mean that there will be contingency plans put into play in hospitals all around the world? Does it mean that there will be a coordinated quarantine programme? I
think it really means that individual states will take the necessary action within that state. So it's not, the WHO doesn't have any powers as such. What it does is advise and support the membership. So it'll depend on the country what steps will be taken.
You were part of the official SARS inquiry. What would you say the main challenges are for governments and authorities with an outbreak like this?
Well, what we learned from SARS was how important it is to share information. You need to share information at the science level because you need to look at the shape of the virus, the genetic makeup of the virus to see if the sequence is changing, because the virus could become more virulent, and so constant monitoring of the virus. And then you also need to share information with the healthcare systems, which will be going on now on a global level, probably was anyway informally, but now formally on a global level, and then share information with the public, because the key thing in terms of controlling the disease is to get the right information, accurate information, shared with the right people at the right level so that you can get a coordinated response.
You talk about sharing information, or the theory of sharing information. How encouraged or dismayed are you at what we've seen from China so far?
Highly encouraged, because last time around with SARS, we didn't even know that there was the disease in China in the end of 2002. There were cases of atypical pneumonia in several places, and information wasn't being shared. And information wasn't shared into Hong Kong, and the cases that started to emerge in Hong Kong in the February and the March of 2003 were quite a shock. And then it became apparent that more was known, there were more cases, and then it took a while to sort out what the virus was, and then it took a while to get people to coordinate their reaction. And in addition to that, the healthcare facilities were really not up to scratch in terms of response. I would say this time round that we've seen exemplary action by the Chinese authorities in terms of sharing information about the numbers of cases, the rapid development of the test, the sequencing of the genome, etc., as well as information to the public. So I think things are much better this time round. And I think you find that the head of the WHO has also complimented the Chinese on the actions they've taken.
How worried are you, though, about the spread of the virus to countries and regions that might be less well equipped to step up contingency plans and preparations?
That's always a problem and always an anxiety, but then it's up to the WHO to help coordinate response in those countries. The key message here is that we need to share the information, but also then ensure that public health measures are taken as well. So in addition to the quarantining and the different decisions about quarantine and border regulations, there's the thing about the individual message, the message to individuals. You need to for example, wash your hands well. You need to, if you sneeze into a tissue and dispose of the tissue. Now, these messages may sound boring, but actually they're really important.